It is the last day of our neonatal labs, and I wanted to talk about the heel stick. I'm gonna pull out my daughter's doll. She's a little lifelike looking, so don't stress out, but this is a doll. And I wanted to tell you what I do to help make myself successful during heel sticks to prevent hemolysis and clotting. What I always do is I get the baby in a good position. For me, is the baby's head is on my left. That's how I was trained, and that works best for me. I get their head on the left, and then I prepare for the heel stick. Prior to doing any heel stick, I have warmed not only the foot area, but also the calf. Warming is a dilator. It is going to bring blood flow to the area you are going to poke. I then get the baby into an ideal position that is good for them and for me. If able, I have swaddled them. I have a second person coming in to do a touch hold. I've given sucrose 2 minutes prior to the slab draw, and then I am preparing the baby. I always put my thumb along the bottom of the baby's foot and then my hands behind their leg. This allows me to be able to see the whole area I'm poking as well as to be able to milk it all together. If you try to just milk the skin, you're only going to get blood from right here. We have to allow for refilling and milking of the calf and the foot together. So I use my hands and my thumb to have that action come together. As I'm collecting the blood, I'm careful not to scrape the container on the foot. That scraping activates clotting factors. Those clotting factors then get into your tube and increase your risk of clotting. Additionally, more hemolysis is happening from the breakdown of this scraping motion. Ideally, you're going to get the blood to drop into the container as you're milking it. So I have positioned the baby, I have warmed the baby's heel, I've given sucrose 2 minutes prior, I have done other pain measures such as swaddling if able and having a second person in there with me. During the lab draw, I am allowing for refill. If you hold this hand behind on the calf too tight, you're also going to cut off the blood flow. So you have to allow for refill behind here. We are not squeezing so hard that we're leaving fingerprints on there, but we're getting this heel into a good position so that the blood can come out and drop into the container so that you don't have to scrape along. And those are my top tips for heel sticks for NICU babies.